Our first medication that has been updated, and we have received a new order for our patient Millie Larson. We have obtained three different orders for medication administration, each one being administered to three different routes. Our first medication that shows in our medication administration record is Haldol 2 milligrams, which is to be administered intramuscular for the control of agitation. Second order that we have received is insulin Lispro 10 units subcutaneously with breakfast for blood sugar management. And lastly, we also received an order for Colace 100 milligram tablet orally as a stool softener. Upon checking the patient's chart, I see that this patient has no known allergies, therefore it is safe to administer these medications. I'm going to go ahead and I'm going to perform hand hygiene, and I will obtain all of my materials. Okay. Our first order, our first medication that I have obtained is a blister pack, individual blister pack of Colace. We are administering Colace 100 milligram tablet orally. On hand, I have Colace 100 milligram tablet. I'm checking for expiration date. The expiration date is December of 2025. So it is safe to administer Colace. In order to administer Colace, I will be using a medication administration cup. Also, we have another order for administration of 10 units of insulin Lispro. Here I have insulin Lispro, which reads 100 units per ml. I'm going to be only administering 10 units, however. On hand, my insulin Lispro expiration date, it's July of 2031. So it is safe to administer my insulin Lispro. In order to administer my insulin, I will be administering with an insulin syringe with clearly marked units. It is a 29 gauge by half. Lastly, I have another order for Haldol 2 milligrams intramuscularly. I have a vial of Haldol that reads 5 milligrams per ml, and the expiration date for this is which is March of 2032. A safety consideration that we will need to consider is that on hand we have 5 milligrams of Haldol per ml, and the order only reads for 2 milligrams of Haldol. Therefore, we would need to do calculation to make sure that we are administering the correct dose of Haldol to our patient. If we do the correct dosage and we do our dosage calculation, we will come to a conclusion that we will only be administering 0.4 mLs of Haldol in order to administer 2 milligrams of Haldol. To administer my Haldol, I have a 3 ml syringe here, which also has clearly marked labels that will allow me to administer 0.4 mLs of Haldol in order to administer the 2 milligrams ordered by the physician. And I have a hypodermic needle of a 22 gauge by 1.5 inches. I have my alcohol pred pads, and I have my gauze to put pressure on the injection sites if needed in case if the patient is bleeding. Okay, so I have gathered all my materials. Now it is time to go into the patient's room. So once again, I have my materials. I'm gonna go into my patient's room. I'm going to once again enter the room, introduce myself. Hello, Millie, my name is Jason. I will be your nurse for today, and I have some medications that I will be administering to you. I'm going to perform hand hygiene, and at the same time, I will make sure that I provide some privacy for my patient. Before starting any procedure or before administering any medications to Miss Millie Larson, I will make sure that I do have the correct Millie, because there might be another Millie in the hospital. So I'm going to go ahead and I'm going to check for my patient and identify my patients with 2 identifiers. Millie, can you please state your name and your date of birth, please? I'm going to check the ID. And I do see she verbalizes that her name is Millie Larson and that her date of birth is 01/01 of 1936. And this is exactly what I see in the patient bracelet. Okay, so Millie, I have a few medications that I will be administering to you. I will explain to you what I will be administering, and I will be explaining to you the reason why we are administering this medication. Is that okay? Patient is in agreement. Okay, so once again I have my MAR. I'm gonna do my third check. I have a MAR as I administer my medication. So I'm gonna start with oral route, then subcutaneous, and lastly I will be doing my intramuscular route. Given that I have interacted with my patient, I will once again perform hand hygiene before administering the first medication. First medication will be Colace 100 milligrams, 1 tablet orally. This medication that I'm going to be giving to you, you're gonna take it, you're gonna swallow the pill. I'm gonna give you some water. It's Colace 100 milligrams, and your physician has ordered this for as a stool softener. Okay, Millie is in agreement. I'm going to don my gloves, and I'm gonna read one last time that I have Colace 100 milligrams. The expiration date is December of 2025. Order reads Colace 100 milligrams, 1 tablet for stool softener. I have my single dose medication. I'm gonna pop it, and I'm going to put this medication into the medication cup. I'm gonna dispose of this in the garbage can, and I'm gonna give this to Millie and make sure that Millie is taking it. Millie is going to take the medication. Here is some water, Millie. Millie will take the water. I will ensure that my patient has taken the medication. Millie has taken the medication, and the medication has been swallowed. I'm going to be disposing of my medication cup. I'm going to dispose of my gloves. And one more time, I'm going to perform hand hygiene. Okay. I'm going to document in my MAR that I have administered the medication and that it has been swallowed. So the next step will be to mark in my MAR that Millie has taken the Colace. For our next step, we have performed hand hygiene. We will be administering our insulin. Because this is a multi-use vial, I'm going to be donning some gloves. This is an aseptic technique, so we want to make sure that we keep the vial and the injection that we are drawing up as sterile as possible. In this case, my insulin Lispro vial hasn't been used, but if this was a vial that has been used, we would have to disinfect the top of the vial. So one more time, I'm going to check against my medication administration record that my order reads insulin Lispro 10 units to be administered subcutaneously with breakfast. So on hand, I have insulin Lispro 100 units per ml. I'm only administering 10, however, and the expiration date is July 2031. I'm going to go ahead, I'm going to open my insulin vial. Okay, I'm going to, if this was already open and it's a multi-use vial, as we have said, we will go ahead and we will disinfect the tip of the vial in a circular motion. We will dispose of this. We are using an insulin syringe. We want to make sure, we got to keep in mind that the syringe is in a sterile package, and we're trying to keep the shaft of the syringe sterile, so we will only be coming into contact with the plunger. Okay. Going to be removing the cap. And the order reads for 10 units. I'm going to draw 10 units of air into my syringe. That reads 10 units. And I'm going to inject 10 units of air into my vial. I'm going to inject. Then I'm going to position in a vertical position, making sure there is no contact with the shaft of the vial of the syringe, excuse me. And I am drawing up a total of 10 units of insulin. Okay, 10 units. Make sure that there is no bubbles. I've gotten lucky and there is no bubbles in my syringe. Going to go ahead, take out. We confirm that there is 10 units of insulin, and I'm going to recap with the one hand method. Okay, so we have recap. Okay, now for this administration purposes, we are going to be using Millie's abdomen. So when we are administering the medication, we will also clean the site. So let's pretend that this orange will be Millie's belly. We will be using her right lower quadrant. And when administering, we'll dispose of this. And we will pinch the site, and we will see this will be the belly. So we would pinch with our non-dominant hand. We would clean in a circular motion. We would dispose of our pad, and we would go ahead, and we will do in a 45 degree. We will enter, and then we will slowly inject the insulin. Slowly retract. Put the safety cap on, and then we will dispose of our needle. At this moment, I do not see gauze. We would open our gauze. We would then apply some gentle pressure, and that's it. Never rub on the site. Dispose of our gloves. Once again, perform hand hygiene. We will be documenting in our MAR that we have administered the 10 units of Humalog of insulin Lispro. We will make sure that the patient gets their food tray because we don't want any hypoglycemic episode. We would move on to our next medication. The order reads for Haldol 2 milligrams intramuscularly for control of agitation. On hand, we have Haldol 5 milligrams per ml. Expiration date is 3 of 2032, so it's within range. Because we have a 5 milligram per 1 ml vial dose, we will only be administering, so we will do the medication and calculation, and we will only be administering 0.4 mLs in total to administer the desired dose of 2 milligrams. Okay, so this is our vial dose. We have our 3 ml syringe with clear indication that I can see that I can draw 0.4 mLs, and I have a hypodermic needle, 22 gauge, 1.5 inch for my intramuscular injection administration. I am going to open the blister, making sure that it stays sterile. Capping. We'll be removing the cap. If this was not unopened, if this was multi-use, then we would go ahead and disinfect the tip of the vial. I am going to draw up 0.4 mLs of air. I'm going to inject such into the vial in a vertical position, and I'm going to withdraw 0.4 mLs. Recap with one hand method. Okay, I will use the vastus lateralis. I will use the right in this case for Millie. Right vastus lateralis. This can be found halfway between the right greater trochanter and the lateral femoral condyle. So once again, I'm going to prepare my site. Vastus lateralis, like we said, we already know the landmark. I am going to hold the skin taut. I am going to disinfect the skin. Circular motion. We will make sure that, like with every administration of intramuscular subcutaneous, that the skin allows some time for it to dry. We would go ahead and grab our 0.4 mLs of Haldol, equivalent to 2 milligrams of Haldol to be administered intramuscularly. We're going to go in a 90-degree angle, and then we will slowly inject the solution. We will retract, put our safety cap on, we will dispose, and if there's any bleeding to the site with a sterile gauze, we would go ahead and provide gentle pressure. Dispose of our gloves. Always hand hygiene, and we would go ahead and document in our MAR that we have administered the medication.